What is the Keller funnel? The Keller funnel is a clear plastic disposable sleeve that's designed to facilitate the atraumatic insertion of breast implants through relatively small incisions. The funnel is used by dropping the implant from the sterile packaging after irrigating it with antibiotic solution into the funnel. The antibiotic solution provides some lubrication so that the implant easily glides through the Keller funnel into the pocket. So with gentle pressure at the top of the funnel, and with the end of the funnel inserted into the incision, the implant can be gently propelled into the implant pocket. The implant is never in contact with the surgeon's gloved hands or the assistant's gloved hands. The implant's dropped directly from the sterile packaging after irrigating it with antibiotic solution into the funnel and then propelled into the implant pocket. What are the advantages of using a Keller funnel? Well, for one, you are minimally deforming the implant surface and reducing the likelihood of implant fracture and possible implant shell rupture during insertion. Without a funnel, one has to take the implant, place it up to the incision site, and then use index fingers to deform the implant and to try to shove it and force it into the implant pocket, which often is a bit of a struggle and creates some risk of internal gel fracture and possible damage to the shell of the implant as well. The other very important reason to use a Keller funnel is it's another thing that a surgeon can do to try to reduce the rate of capsular contracture. We think that most cases of capsular contracture are related to contamination of the implant surface the day that it's placed in surgery. The skin can be prepped with antiseptic solution, but skin cannot technically be sterilized. There are hair follicles, sweat glands, sebaceous glands, all sort of structures just below the skin surface that can harbor bacteria. And pressure at the skin surface during surgery may force some of the bacteria out of these glands onto the skin surface, where it can potentially contaminate the implant. If you introduce the implant with a Keller funnel, you're bypassing contact with the patient's skin, and thereby potentially reducing the rate of capsular contracture long term. Make sure that the surgeon you see for breast augmentation is using the Keller funnel. It provides significant advantages that may reduce your rate of contracture and implant failure over time.